Yeah.
Thank you.
Mm-hmm.
Testing.
Oh,
One, two, three.
And then Dr. Calderon, the testing 1, 2, 3.
Testing 1, 2, 3.
And then one more time.
Testing 1, 2, 3. That one moved a little bit like this in the last second. No.
Hey, Stephanie, David.
We're
How's
both
it going?
patients.
Yeah. Oh, sweet. All right, we're all set.
So you can randomly, you can just chat amongst yourselves if you'd like. It's a
Okay.
very casual, fun kind of thing.
Okay.
And
Hello,
so
David.
randomly pick one question. We'll do 5 questions total.
Sounds good. Okay.
All right. Go ahead.
So I'm going to pick a question out of the bowl, Dr. Calderon.
Okay, go ahead.
I'm going to get to the bowl. Okay. What are the early signs and symptoms of kidney disease that I shouldn't ignore? I'm going to turf this question to Dr. Calderon because he's a much better clinician than I am.
Now,
That's your question. Dr.
what
Calderon.
are the early signs and symptoms of kidney disease that I should not ignore? Okay. Well, early signs of kidney disease, it's hard because when you have kidney disease, some of those signs do not appear until later. So recognizing them early, it's tough. But you could pay attention to a couple of things. Uh, Progressive tiredness, fatigue, skin itching. You look more pale. You when you have kidney disease, you're not able to make match red blood cells as you're supposed to, but that occurs usually in the advanced stage of the disease. But nonetheless, you should know if you start appearing pale, more whitish in general. If you have trouble concentrating and you know you have kidney disease or a lot of problems with sleep, those are signs of uremic toxin buildup. That means that your blood is containing more toxins than it should. So those are signs you should pay attention to.
What about leg swelling?
Yeah, absolutely. Thank you. If you start retaining fluids and you notice ankle swelling or swelling in other parts of your body, definitely bone pain can happen as well. If you feel bony pain, deep in your legs or arms. What else am I missing? Any other signs of? Yeah, in general, what we call constitutional symptoms: fatigue, tiredness, trouble sleeping. Sometimes weight loss, appetite changes, and you know you have kidney disease, talk to your doctor because those are signs that disease is progressing.
Well done.
Yeah.
So can you fix the plant in the back? Move it to the other side, same place. Yep. You get to pick the next question.
Oh, okay. Ready?
We'll wait till she's out of the field. Good.
All right, my
You
turn.
pick the next one.
What are the most common causes of kidney disease, Dr. Namazi?
Wow, he's putting me on the spot. Okay, so, and you jump in whenever you want, but in developed countries like the U.S., diabetes tends to be really the most common thing we see as a causing kidney disease. So if you're diabetic, make sure you're taking care of your diabetes. Make sure you're getting good follow-up with your doctor. Keep an eye on, make sure it's not affecting your kidneys. So I would say diabetes is probably one of the biggest ones. And often it's in combined or combination with other things like high blood pressure.
Mm-hmm.
Those really are the two big ones that we focus on. We all lose some kidney function as we get older. So as we get older, we need to keep an eye on our kidney function, especially if we have some of these other illnesses like diabetes and high blood pressure. But then there are other causes. Older people can have an enlarged prostate, older men, and can obstruct the flow of urine, and that can cause kidney disease later on in life.
Mm-hmm.
And then there's some diseases of the filters of the kidneys, what we call glomerular diseases, that are less common than things like diabetes, but nonetheless do contribute to a significant number of patients having kidney disease every year. And we call these glomerulonephritis. They affect the little filters that are inside of the kidneys. Am I missing anything?
No, those are the most common ones. If you know you have a history of kidney disease in your family, just pay attention to that. People have something called IgA nephropathy. It's a common, as Dr. Masi said, it's a common glomerulonephritis, and as the most common glomerulonephritis in the world. So if you know somebody in your family has something like that, IgA nephropathy or lupus or something like that, that can be, it's an infrequent cause, but it's a frequent cause among people that have a history of that in their families.
Yeah, well said.
Next question.
Yeah.
Okay. What questions would be helpful for people to ask their doctor about their access care? Okay. So, you know, most access related issues for dialysis patients really are pretty evident when you go to dialysis. So, but there are certain things that you can pick up on as a patient where you know that there's a problem with your access potentially, and it should be looked at. One of the common things we see is bleeding. So if after they take the needles out at dialysis and you're having to stay there for a long period of time because you're bleeding, that's a big sign that there's problems. Or if you remove the bandages at home and you're still bleeding, or you wake up with bleeding, or the next day you're still bleeding from your access, that's a common cause or a common sign that you know that there's a problem and you should talk to your doctor about that. If they're having trouble using your dialysis access, like putting the needles in, there's usually a problem. If your tech is really struggling to get the needle inside the access, that shouldn't happen. We know a good access, any tech at the clinic should be able, or nurse should be able to use your access without too many problems. And if they're having trouble getting into it, then you need to talk to your doctor and say, hey, what's going on? If you're bruising a lot, if they're infiltrating and you're getting big areas of swelling, or if your arm is swollen in general, if the machine is alarming a lot, telling the staff that they're not getting enough blood flow from your access, those are all potential things that you want to be aware of. Oftentimes every month, they will be looking at certain measures on the machine to tell them how your access is doing. They look at pressures, they look at blood flows, and those will be reported to your doctor as well, and they'll know whether they need to refer them to folks like us to determine if we need to take a look at your access.
Very good.
One more. Yeah.
Oh, one more. Who's third?
Your turn.
Okay.
Don't try to get out of this.
Oh, they're calling. Okay, I can answer this. What should I do if I experience any problems with my access? You want to start with that one?
Well, I think you should just let your nurses or doctor at dialysis know. Or if you have a good relationship, like we do with a lot of our patients here at the San Diego Vascular Access Center, a lot of our patients just call us directly because, you know, we're also dialysis doctors, and I think that's one of the benefits of coming here with us. You know, in years past, patients would have to go to the hospital for this, and you would get the doctor of the day who didn't know anything about dialysis or dialysis patients. And so the beauty of coming here to us is that we're also patient. We have patients that are on dialysis, and we take care of a lot of dialysis patients. And we are able to put that together with the problems with the access and fix those problems. So reach out to your doctor at dialysis, your nurses at the dialysis clinic, and let them know, or you know, reach out to your access center, you know, directly if you have that relationship. I would say.
Yeah.
What else?
Yeah.
One last thing. Oh, I'm sorry.
No, it's okay.
We have another.
No, I think that's just have a close relationship with your tech or your nurse at dialysis will, so you can feel confidence that those problems will be addressed. Or if you have the experience of coming here to the access center, you can call or have your doctor refer you to us.
I forgot to have you introduce yourself in the beginning. You don't have to go into anything, detailed. Just name and what you do and where we're at.
And maybe what you're about to do. We're going to answer some questions.
Okay. You want to go first?
Yeah. My name is Juan Calderon Molina. I'm a clinical nephrologist. I come to the Access Center twice a week to do interventional procedures on fistulas, grafts, and place catheters sometimes. And I'm lucky to have Dr. Namazi as a colleague here who has a lot of expertise in this field.
Thanks, Juan. I'm David Namazi. I started the Vascular Access Center with my partner, Dr. Barron, 23 years ago, and I'm the medical director here at the San Diego Vascular Access Center. I'm here pretty much day to day, and oversee operations and do endovascular procedures on our dialysis patients.
And we're here to answer some questions.
Oh, and we're here to answer some questions today about access care and kidney care in general.
Can you just say for me, we're here for a shop talk.
Yeah.
At the same time, or?
Yeah, that would be good.
Oh, okay.
All right, 1, 2, 3. We're here for Shop Talk.
Cute. I love it.
Okay.
Thank you.
Okay.
The mic's real quick for you. Yeah.
And when
then we can still
and we
interview.
can
Oh, yeah.
Okay.
Thank you, Dr. Calderon.
Yeah, let me know if you need my help.
Which seat do you want?
me to
The
sit
left seat, but let me get some stuff.
Your left. His left, sorry.
in? Yeah.
Thanks, David, for reminding me that I need to have an